The neurology department at Beth Israel Deaconess Hospital, Needham, saw a disturbing trend of people heading to the emergency room days after experiencing symptoms of a stroke. A stroke occurs when something blocks blood supply to part of the brain or when a blood vessel bursts, leading to parts of the brain becoming damaged or dying. According to the CDC, someone in the U.S. has a stroke every 40 seconds, and they are a leading cause of serious long-term disability. Stroke reduces mobility in more than half of stroke survivors. The good news is there are ways to decrease the chance of severe disability from a stroke. Maureen Kelly-Fromm explains why the key is to act fast.
We talk a lot about the FAST mnemonic. It's an easy way for someone to remember some of the major signs of stroke. FAST stands for F, facial droop. The A stands for arm weakness. It's also important to look for leg weakness. You can ask the person with the symptoms to hold their arm up in the air and look to see if there's a drooping down of the arm. The S stands for speech. Is the person having word finding trouble? Are they having trouble speaking coherently? Are they having difficulty putting a sentence together that makes sense? Do they have difficulty understanding what others are saying to them? Or are they slurring their words? And then the T in FAST stands for time. The patient or their family needs to call 911 as quickly as possible.
In order for treatment to be effective, patients need to make it to the emergency room within 4.5 hours of having a stroke.
We have the medication called TPA. It stands for tissue plasminogen activator. It's a medication that can be given through a vein to bust up the blood clots and improve blood flow to the part of the brain that wasn't getting it. That medication has been shown to improve a person's disability score 90 days after onset of the stroke. 30% of the patients who get the medication will have a measurable improvement in their disability outcome. So if you take a person who without the medication, maybe they needed a person's help to walk because of the stroke. It was impairing their leg strength or their balance, and they get the TPA. There's a good chance that instead of needing someone to help them walk, that maybe they'll just need a walker or a cane to walk.
Controlling medical conditions that are a risk factor for stroke, including diabetes, high blood pressure, heart disease, high cholesterol, can help prevent a stroke. That means taking prescription medications as directed and living a healthy lifestyle, and not smoking. For the Needham Channel News, I'm Maureen Kelly-Fromm.